Hi, my name is April Holman, and I am the Executive Director of the Alliance for a Healthy Kansas. Welcome to the latest installment of the Alliance for a Healthy Kansas Town Hall Series. This series is intended to elevate the work of our partners in the Alliance for a Healthy Kansas Coalition during the COVID-19 pandemic, and also to amplify their needs and concerns during this really challenging time. Our town hall today highlights the work of our partners at Kansas Action for Children, and specifically in their project, the Kansas Center for Economic Growth. We're really happy to have Emily Fetch, the Director of Policy and Research at Kansas Action for Children, with us this afternoon. Hi, Emily.
Hi, thanks for having me.
Yeah, thank you so much for sharing your analysis and insights about the state fiscal outlook today. Just for our listeners who might have questions, we'll want you to type your question in the comments below this video, and we'll answer those questions at the end of the town hall or in writing if you're watching a recorded version of the video. So with that, I'd like to just jump into our questions for today. Emily, can you start by telling us a little bit about the state tax and budget work that you do?
Yes, well, thanks again, April, for having me and for letting me talk to all of you about state tax and budget work and why it matters all the time, but particularly right now during this COVID-19 crisis. In Kansas Action for Children, we engage in budget and tax policy because we know without good tax policy, we can't bring in the revenue that is needed to create a budget that can make the investments that we know our state needs. And so we do this in different ways. We work to identify responsible revenue policies to improve our state's budget and its ability to meet its obligations to Kansas residents. We work to repair and reimagine our tax code to make it more equitable. And we work to inform the public opinion and to translate these kind of complex, sometimes wonky issues of budget and tax policy for broad audiences, whether it's everyday Kansas residents or Kansas policymakers.
Awesome. Well, we know that businesses have been hit hard by the pandemic, and it sounds like experts are predicting that it will mean a large reduction in state revenues. Can you tell us more about the updated revenue estimates for Kansas and what that might mean for the state budget?
Yes. So recently on April 20th, the Consensus Revenue Estimating Group, or the CRE, met to determine or project what the state general fund revenues will be for the next 2 years. And so they meet twice a year in November and April. So when they met in April, they estimated that there is going to be a significant decreased revenue due to the economic downturn caused by COVID-19. And so compared to the last CRE in November, they're now anticipating a drop of more than $1.27 billion in the next 2 years. And the decreased revenue really comes from a variety of all of the kind of tax sources that make up the state general fund. And the state general fund is really kind of the main piggy bank of the state. But two of the largest sources of revenue for Kansas are sales and income tax. And as you think about it, it makes sense right now with COVID-19 why we would see declined revenue with individual income tax. As employers are laying off workers, as we see this rise of unemployment, workers are going to be earning less income and then subsequently paying less in their individual income taxes. And then similarly with sales tax, it is normal during economic downturns for people to cut their spending. And it's often the first revenue source to decline. And during this kind of weird COVID-19 world we're living in, where businesses are, literally shuttered for the good of public health, people aren't just choosing to, not spend. They have less opportunity to do so because businesses are closed. So that sales tax revenue decline impact might actually be more pronounced than what we usually see during economic downturns. Kansas and the country have been through economic downturns before. We've seen unemployment before, but this economic fallout is really unusual just because of that kind of massive onset of unemployment all at once. But we saw during the Great Recession, we saw kind of during the self-imposed recession of the Brownback years, that when there are declined revenue, decreased revenue, the state has to make hard decisions. And so moving into kind of your question about what this means for the state budget. We got an update of what the budget would look like for the next 2 fiscal years based on the CRE estimate. So the new ending balance for fiscal year 2020, which is what we're in currently, which ends July 1st, is $205 million. So we still have enough money to get us through the end of July and the end of this fiscal year, although it's much less than what we initially anticipated. When the legislature shut down in March, we thought that we would have an ending balance of 900 million. So we saw a decrease from 900 million to about 200 million. However, the problem really comes with fiscal year 2021. So there's now a projected $650 million budget shortfall. And unlike the federal government, Kansas can't deficit. So we're going to have to figure out how to get us to a positive ending balance. But what we have learned from past recessions and past kind of economic fallouts is that Kansas can't cut our way to prosperity. We tried during the Brownback years to do that, where we saw round after round of budget cuts to make up for the decreased revenue that was coming into our state from his irresponsible tax cuts, and it didn't work. And we can't afford to do it again in response to this economic downturn.
Yeah, it's interesting. We have been thinking about those things, those types of things a lot in the last month at the Alliance for a Healthy Kansas in the context of Medicaid expansion. And I know we're going to get into that a little bit in just a few minutes. But yeah, I think that the idea that only cutting will bring you out of a downturn has just been proven time and again not to be successful. So I really appreciate that work that you all are doing in analyzing that here in Kansas. One thing that I'm curious about, is there anything that state policymakers can do that would speed up the economic recovery?
There are 3 things that I would suggest state lawmakers think about doing right now. And the first kind of goes back to what I was just talking about, but continue to invest in programs that work. So the decline in revenue is a challenge for Kansas lawmakers, but now is not the time to make harmful cuts to programs that people need now more than ever. It's really the time to continue to invest in our state and its people. And it is possible to stabilize revenue without sacrificing vital programs that are proven both to provide assistance during critical times such as these, but also to help the economy during this downturn. And the second recommendation I would have for state policymakers is to make it clear to the federal delegation that more federal investment is needed and that the federal monies need to have greater flexibility to help cover these lost revenue sources that we're seeing. So the federal government gave Kansas $1.25 billion in state aid to address the COVID-19 crisis, but that's not enough money and it's not flexible enough for how we need it for our current needs. So for example, during the Great Recession, state governments were allowed to use their federal funds to backfill lost revenue, which is not the case today. Also related to kind of federal responses and how it relates to direct health needs, the federal response has provided critical resources to hospitals and states to cover COVID-19 related costs, but it did not expand healthcare coverage or cover COVID-19 treatment for the uninsured, which brings me to my third recommendation, which is expand Medicaid. Regardless of what happens with federal changes, Kansas needs to expand, and we'll talk about this a little bit more, and I can provide more details, but it will help generate economic activity. It'll make our state healthier overall, and it will help people who have lost or will lose their jobs remain uninsured.
Yeah. So what do you think, what would the next steps be along those lines? So the federal Congress has come together to develop, I think, three and a half rounds of federal assistance. We've heard a little bit about another round that is in the works, but we don't really know exactly when to expect that might come down. But from a state perspective, what do you see as the next steps?
Well, one thing that will really determine those next steps that's happening this afternoon is figuring out whether the legislature is going to return this year. So the Legislative Coordinating Council is meeting today at 3 p.m. to decide that. And so that will really kind of help us think through what are the next steps. Is there going to be a legislature returning to the State House this spring, or are they going to be waiting until the next session in January? So if the legislature doesn't return, then the governor will be able to accept and allocate any federal dollars that the state has received or will receive if there's another round of federal assistance. And in addition, the governor will have allotment authority if we have a negative ending balance, which all signs indicate that we will have a negative ending balance for that fiscal year 2021, which starts July 1st. So it would be when the legislature, if they're not coming back, would not be there. So to address the negative ending balance, the governor could make allotments in two ways. So one, she could make custom allotments to the agencies that she directly oversees, kind of in her executive capacity. And then second, she could make a universal percentage cut across the board, which would have to be reviewed and approved by the State Finance Council. If the legislature did return, then they would probably take over some of the responsibilities for kind of those budget decisions and how federal dollars are allocated. So it really is tune in this afternoon and find out, and we might know a little bit more what next steps might look like and what those options are.
So, at the Alliance for a Healthy Kansas, we really are focused on the Medicaid expansion, and we've talked for many years about the economic impact of expansion, both at the state and local levels. But I think that really under the COVID-19 scenario, it probably is even more important, and it changes the analysis for that just a little bit. I wonder, could you share from your perspective how Medicaid expansion might play a role in the state economic recovery?
Mm-hmm. So there are really two emergencies that COVID-19 has unleashed, and then there's the public health crisis, and then there's this economic crisis that's resulted from the unemployment and freezing of economic activity in Kansas and across the country. So Medicaid expansion would address kind of the public health crisis and simply that, like, people need medical coverage right now. We want to make sure that people feel comfortable getting tested or getting treatment. That makes not just the individual safer and healthier, it makes us as a community and as a state healthier. So expansion can help alleviate some of that and really encourage people to seek medical help. Second, with the economic piece, as I mentioned before, and I'll mention again, I mean, the Medicaid expansion can prevent people from becoming uninsured and experiencing the further economic hardship that often occurs with being uninsured. So with these high rates of unemployment, many are losing their healthcare coverage, either because they had employer-sponsored coverage, which they lost when they lost their job, or maybe with a lost hours or reduced hours, they can't afford the health insurance that they were maybe purchasing on their own. And this problem doesn't just exist in Kansas, right? It exists across the country, that people are suffering from unemployment. But for expansion states, those that are losing coverage could shift to being insured through expansion or through Medicaid. Those who are in non-expansion states like Kansas, if they're losing their job and unable to afford insurance on their own, they're going to have less options, and that it might most likely result in being uninsured. And this is a problem because uninsured folks are more likely to delay or avoid seeking care, which again jeopardizes not just them, but right now during this kind of public health crisis, all of us. And again, as I mentioned before, the expansion could help offset economic hardships people are going through enough right now without the additional economic hardship that being uninsured can cause. And then more related to your question, April, is expanding Medicaid could really bolster our economic recovery because it will bring in additional federal dollars at a time where they're really desperately needed. So the budget shortfall is troubling, but that's not a reason to not move forward with expansion. In fact, I think it's the reason to expand. By bringing in federal dollars from expansion, we can have an increase in economic growth. And this is because the federal government pays 90% of the cost for people with Medicaid expansion coverage. So for every dollar that the state spends on coverage for this expanded population, it will bring in an additional $9 in federal matching funds. And we haven't expanded Medicaid for years, and we haven't fully utilized all of the federal dollars that we're entitled to. And so our state has rejected billions of federal dollars that we could have used then, that we could use now during this time of economic strain. And so this infusion of federal dollars from expansion that we could do right now could help our economy recover from this economic downturn. A recent report suggests that the initial roughly $1 billion that the federal government, federal funds would bring to Kansas for expansion would have a multiplier effect and would lead to $1.8 billion in total economic activity. The same report shows that it would lead to additional tax revenue. That thing that I mentioned we need, revenue, more revenue, and have an additional $30 to $38 million in state taxes would be brought in during expansion's first full year. And then finally, I would say that expansion is good for our economy because it will help us be more economically competitive with our neighbors. So Missouri's gearing up to put expansion on the ballot, and Oklahoma is looking into executive action for expansion. And so Kansas could soon find itself a regional outlier and face economic development disadvantages if our neighboring states are benefiting from these federal dollars that we haven't taken advantage of.
That makes a lot of sense. And I think that, you know, as we look at the workforce that we're going to need to help pull us out of the, you know, into recovery, we're really going to need that healthy workforce to help drive that increased economic activity as it starts up. So that seems like it, you know, it makes a lot of sense from both the economic standpoint, and really it shows that connection between health and economic prosperity. Mm-hmm. So very good. Well, I am very grateful for your willingness to take time out of your schedule to share with our viewers. I would just open the floor up to any questions that people might have that are listening. And so I'm going to pause just for a moment. I'm not really good at pauses. So, but we want to make sure that people have enough time to send us questions if they have any. And it seems that so far we don't have any questions. I do think a lot of us are just kind of waiting on pins and needles to find out what the Legislative Coordinating Council will say this afternoon, and whether we will even see an opportunity for policymakers to do any legislation in the remaining part of the legislative session. So I think that, you know, we'll probably know more by the end of the day, but we hope that people will kind of stay tuned to this issue. It looks like we still don't have any questions. So I am going to thank Emily so much for being with us today and sharing your tax and budget knowledge with our audience. We're grateful for your partnership in the effort to expand Medicaid in Kansas. And I also want to thank, I didn't mention this earlier, but I should have. I want to thank our American Sign Language translator, Kim, who is helping us today. And then finally, I want to say thanks to all of the people watching this town hall. If you're not already part of the Alliance for a Healthy Kansas Network, we hope that you will join in the effort as well. It's as easy as texting the word CANCARE, K-A-N-C-A-R-E, to the number 52886. So I'll repeat that. The word is CANCARE, K-A-N-C-A-R-E. And if you text that to 52886, that will help you to receive updates from us and alerts and what have you as things transpire with expansion. You can also find more information on our website, expandcancare.com, expandcancare.com. With that, we will sign off. If you do think of questions, or if you're watching this in recorded format, please do put comments in the box on Facebook, and we will monitor that and try and get you all of the answers that you need. Thanks again to everyone that participated. I hope that you have a healthy rest of the week.